Yes, some big news coming in from Karnataka. Shocking revelation by the Karnataka Minister Ashoka. He reveals that 3,000 COVID positive patients have switched off their phones and have gone missing from Bengaluru. Police have now been asked to trace them. This is a shocking piece of information that's come in, that's been admitted by the Minister of Karnataka itself. Ashoka says that at least 3,000 positive COVID patients, those who were in home quarantine, have switched off their phones and are untraceable from Bengaluru. In fact, the police have now been asked to trace them. Nolan Pinto joining us live for more details. Nolan, this is a shocking piece of information coming in from Karnataka, where we're seeing a surge in COVID cases in Karnataka. Bengaluru particularly a hotspot now, the worst hit city in the country right now. 3,000 COVID positive patients who are home quarantine have switched off their phones and may not be traceable. How does the police plan to trace them?
Well, Nabila, it's extremely shocking because the Revenue Minister comes out and states that around 2,000 to 3,000 of them have switched off their phones. Now, why their mobile phones are important, their numbers, because the government, the BBMP over here in Bengaluru, keeps track. The health officials call them, they find out what's their condition, they ask them if they've taken their medicines, they ask them what's the oximeter. Basically, the parameters, they have to keep informing the officials. But now with these 2,000 to 3,000 people who have actually switched off their phones, the government has no idea whether they're still in Bengaluru, whether they've actually gone to different districts. That's the problem. If they're still in Bengaluru, are they at their same homes, in their same houses that they've given actually the address? No one knows, and that's the reason why the police are being sent. If they have left Bengaluru and they've gone to various districts, that is where the spread of the disease is taking place, the virus. That is very clearly what he says is in Bengaluru, the surge is also one part taking place because of these people. He's requesting them, please switch on your phones, because when your mild infections are present, your symptoms, it can be treated. They switch on their phones when things go bad and they go running for beds. This is what the minister stated. Switch on your phones. Let the government know where you are. You can, and let them treat you on the phone. The medicines, of course, are free.
Well, it's not just about the person itself who switched off the phone, but if they are stepping out, that's where the situation worsens, because it's just a super spreader event in that case. One person stepping out, getting into a crowd or meeting with people is nothing short of murder. That's how bad the situation is. Currently, 229 people in Karnataka over the last 24 hours have lost their lives. Nolan, let's hope the police are efficient enough in actually tracing back those people. But are they still putting up those stickers right outside? Is the BBMP putting up those notices outside houses of those positive?
Well, in fact, that practice was stopped last year itself towards the fag end. The government does not do that. However, if there is, say, about 5 or 6 cases in a particular area, that area is known as a containment zone. They don't put up stickers. They do ask people not to come outside. The health officials keep track. They have complete tracking and testing. They make sure that people are isolated, and everyone in that particular area is tested by the BBMP and the health officials. So they have stopped that procedure of putting up placards or putting up barricades.
Thank you very much, Nolan, for joining us with those details. But it appears that the officials there, even though despite it being a containment zone, if anyone is leaving that area, there's really no way or means to reprimand them, to spot them and actually put them back into their homes for quarantine again, or even be punished. How can you punish a person who's actually positive and getting out of their home? Who is to know who is positive and who's not? This is the crisis that Karnataka currently is witnessing, with the minister itself admitting that about 3,000 people, positive COVID-19 people, have switched